Okay, so I've done my 30 seconds of centering. Now I'm gonna go over my SBAR with my preceptor. So the patient today that I'm seeing is Jack Quick. He's an 88-year-old Caucasian male. He recently suffered from an L cerebral infraction. He's on limited mobility due to DVT. He also recently got influenza vaccination. He's hypertensive. And for vital signs, we have a 37 degrees Celsius for temp, pulse is 52 irregular, respiration's 18 in shallow, blood pressure is 130/66, O2 sat is 95%, pain is 3 out of 10, and for his skin assessment, we found a hematoma bruising in the right upper abdomen. This is related to the medication he's taking. He's on heparin, which one of the side effects is bruising. Another concern that we had was the fact that his wife wasn't coming in that much, so we think he might be suffering from sensory deprivation. So during his assessment, I would recommend that we include more touch, more communication, maybe just be more present with him and really focus on his overall mental health. But another recommendation that I think we should do is, considering that his blood pressure or his pulse rate is 52 and it's irregular, I don't think we should prescribe metoprolol because that is one of the it is too low, and so we were told to place the medication on hold if his pulse rate were to drop below 60. So I won't be prescribing metoprolol, but the heparin is still okay to prevent the embolism. And then during my assessment with him, I will be sure to be more present and communicative. So those are some of the things that I'm going to do for him. So now I'm going to take my order sheet and compare it to the MAR. But before that, I'm going to make sure that the order sheet matches the MAR. So I'm going to go through each page and make sure we have the correct patient. So I have Jack Quick. He has no known drug allergies. His date of birth is 1/20/40. That's correct. I have Jack Quick. No known drug allergies. Date of birth is 1/20/40. I have Jack Quick. No known drug allergies. Date of birth is 1/20/40. Perfect. Now I'm going to go through the medications. So I'm going to start from the top. So I have acetaminophen, 650 mg oral every 6 hours PRN for temperature greater than 38.5 Celsius or moderate pain. Albuterol, MDI, 2 puffs inhaled every 4 hours, PRN for wheezing. That's correct. And then metoprolol, 25 milligrams oral, twice a day. Hold for heart rate greater than or less than 60, which that's going on with Jack, so we're going to hold the medication. Or systolic blood pressure less than 100. And then we have heparin, 5,000 units, sub-Q daily. Okay, so now that we are done with this, I'm gonna put away the order sheet. I'm going to grab my medications from the cart. Okay, since we know that Jack Quick is at the right place, so I'm going to be opening the right drawer for him. So now I'm going to grab the first medication, which is heparin. We have 5,000 units, sub-Q daily. That's perfect. The expiration date is 12/20/30, and our patient has no known drug allergies to it. And so with that, I'm gonna grab the correct syringe. So since it's a subcutaneous injection, we're gonna grab a 25 gauge, and then the length is 0.625, so that's 5/8, so that's perfect. And then I'm gonna grab alcohol wipes, a cotton ball for him for the pressure, and maybe some tape as well. Okay. And also, since Jack has a pain at a 3 out of 10, we're not going to be prescribing acetaminophen either. So then I will be doing my mathematical calculations to make sure that we will be administering the correct dose for our patient. So we have 5,000 units heparin, okay, and the ordered dose, so it'd be 1 milliliter, okay, and 5,000 units was ordered. Okay, let me just do my math here really quick. It would be 5,000 times 1, because there's 1 milliliters, and then you're going to divide that by 5,000 because that is the dosage strength. So it'd be 1 milliliters is what we will be administering to Jack. Okay. So I'm going to grab my alcohol pad and clean off the top of the vial. But before I open this, I'm gonna sanitize my hands. Okay. Now, I'm going to clean the top of the vial for 10 seconds. Okay. While that's drying, I'm going to write the label for Jack Quick. So we have Jack Quick. The medication is heparin. We have 5,000 units is the concentration. 1 ml. The expiration date is 12/20/30. Date of birth 1/20/40. Perfect. And I will have that ready for when we do the next part. So now I am going to open my syringe. Make sure that it's sealed. Put in the correct amount of air in, so we will be administering 1 milliliter. So I will put the right amount in here. So 1 milliliter. I'm going to do the rainbow. Okay. I'll be inserting this. Drawing the right amount of medication, first putting in the air. Perfect. Making sure there's no bubbles in here. Looks good to me. Rainbow again. I'm going to do a one-handed scoop. Okay. And so I will put the label on the syringe now. ready to go. Done with this. Like that. Okay. Now, I'm going to go through the check process one more time to make sure we are going to give him the right amount of medication. So here I have heparin, I have Jack Quick, date of birth is 1/20/40, perfect. He has no known drug allergies to this medication. We will be administering 1 milliliters because I did the math already. The medication is heparin, 5,000 units, that's correct. Subcute daily, yep, I'm confirming that. The expiration date is 12/20/30, and our patient has no known drug allergies to this medication. We're also not going to be administering metoprolol because his pulse is very low, and it's irregular. And then we're not going to be administering acetaminophen because his pain is 3 out of 10. So now that I am done with this, I'm going to put it back into the cart because we no longer need it. I'm going to lock the door. Okay, I'm going to grab my right equipment, and then I'm going to go and see the patient. So I've walked into the patient's room. I'm going to get my hand sanitizer and do hand hygiene. I'm going to close the curtain behind me for privacy. Hi Jack, how are you today?
I'm doing great.
My name is Keisha and I will be your nurse today. How are you feeling?
I'm feeling alright, Keisha. Thank you for asking.
Yeah, okay. Before I get started, can I just have you confirm your name and date of birth?
Yes, my name is Jack Quick. Date of birth 1/20/40.
Perfect. And do you have any allergies to medication or food?
None that I know of.
Okay, so today we will be administering heparin, and that's just to help with the DVT. I will just ask that you inform any of us healthcare workers if you see any abnormal bleedings of like around in your skin. That's just a concern of ours. So if you could do that, that would be awesome.
Okay, I will be sure to look out for that.
Okay, so before I administer the medication, I'm gonna look to make sure we have the right amount. Okay, so for a patient, I have Jack Quick. He has no known drug allergies. His date of birth is 1/20/40. The expiration date to the medication is 12/20/30. The medication we will be administering is heparin, 5,000 units. And our patient has no known drug allergies to it. We have the correct syringe with the appropriate amount of medication, which is 1 milliliters. Okay, so since this is a subcutaneous vaccination, I'm going to insert the medication 2 inches below your abdomen. So I just want to give you a heads up.
Okay.
I'm going to sanitize my hands, put on gloves. I know it can be a little nerve-wracking, so if you want, there's a beautiful picture over there and you can look at it.
Oh, thank you.
Okay. So I'm just gonna lift your bed a little bit so I'm able to administer the medication, and I'm also gonna put this handrail down. Okay. So I have the medication. Rainbow. I'm going to insert it 2 inches below the abdomen at a 45 to 90-degree angle. I'm going to pinch the skin up. Insert the medication like a dart. Okay. Stabilize. Slowly inject it. Remove it, put the safety on immediately. So I just realized that I forgot to clean the site. So for next time I will do that. But going back to Jack, I'm gonna just add this cotton ball right here. Is there anything else I can do for you? How was that for you?
I'm doing good. All is well.
Okay.
Great job.
Would you like a Band-Aid? I don't know. Are you okay?
Oh, I'm good. The cotton ball will work.
Okay, perfect. Now, is there anything else I can do for you?
Nope, that is it.
Okay, perfect. And don't forget to just let us know if you feel or if you notice any abnormal bleeding around in your body, and if you're just not feeling like yourself, okay?
Okay, I will do that.
Perfect. I'm going to put down the bed, bring up the side rail. Your call light is right here if you need anything. Okay, Jack?
Okay, thank you.
Okay. I'm going to remove my gloves. Do hand hygiene. Okay, Jack, I'll be back in about 15 to 30 minutes to check on you, okay?
Alright, sounds good. See you then.
Perfect. Close the curtain and shut the door.